Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. We have a lot of unusual topics today, some having to do with wacky, harmful requirements from health departments, some having to do with childhood diseases. But before we get there, down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter. You can go there, subscribe for free, get it delivered to your inbox most days. And it has all of the links I mentioned, links to medical reports, news stories, background material, as well as a lot of healthcare reference material. So let's start. Whooping cough is now surging in the United States. And the latest data from the CDC suggests there are no signs of it slowing. In my neighborhood, there's at least 420 kids who have it. There have been more than 32,000 cases so far this year. That's from mid-December 2024. It's about 6 times more than there were at this time last year. Whooping cough is called pertussis. It is a very contagious respiratory illness, bacterial infection. It starts with symptoms like the common cold, runny nose, sneezing, low-grade fever. But after a little while, you get this full body cough that takes a week or two to develop. This coughing can be so severe that it can cause patients to actually vomit or break ribs. They're often accompanied by a whooping sound as the person tries to catch their breath. The coughing can last for weeks or months, and people can spread the infectious bacteria for weeks after the cough develops. However, you might have a mild infection, and you could still spread the illness to others, and you may just think you have a cold and not even imagine it's whooping cough. It's really dangerous. So what's the answer? Vaccinate. According to the CDC, the percent of children vaccinated by age 24 months with 4 or more doses of DTaP is 80%. That's for kids that were born in 2016. Whooping cough, as I mentioned, usually starts with cold-like symptoms, but it can be incredibly severe, but not in babies. They don't always get the coughing. They can sometimes experience life-threatening pauses in breathing, gagging, or gasping. So for children, infants, it can be just deadly. Anyway, the best way to prevent it, as I said, get vaccinated. Now, the CDC recommends that children get 3 doses of DTaP, that's diphtheria, tetanus, and acellular pertussis, at 2, 4, and 6 months, and 2 booster shots, one between 15 and 18 months and one at 4 to 6 years. Now, 95% of the children from 19 to 35 months have received at least 3, but 4 or more, we are not doing good. People with whooping cough, get to a healthcare provider as fast as you can. See if they have to test you further. See if they can give you an antibiotic. That could help. You know what, there's a really important action to take, and it is, if you have children or adolescents in your sphere of influence, just make sure that they're vaccinated, because you know what, their health relies on you being diligent. I want to talk now about Louisiana. It is like the worst place in the country for healthcare. Flu season is ramping up across the U.S., but Louisiana, it's different. The state has reportedly barred health departments from promoting flu shots or COVID-19 shots or monkeypox vaccines. It is leading the country with an early and strong surge of flu. Louisiana's flu activity has reached the very high category set by the Center for Disease Control and Prevention, according to the latest data. The 13 category scale is based on the percentage of doctor visits that were for flu-like symptoms. In the previous week, Louisiana is at the very first of 3 very high levels. Oregon is also up there in the high level, at the same high level. Now, the rest of the country is all over the scale, with the 13 jurisdictions at high, including New York City, Washington, D.C. There are 11 moderate and 10 at low and 19 at minimal levels. If you go to my newsletter, you can find a graph of a chart of the United States showing how your state is doing. Look, this is just so hateful what they're doing. Louisiana has the worst life expectancy in the United States. It has lax gun laws, very lax worker protection rules. It is unsafe, and they have a petrochemical industry that's poisoning people like crazy. And now they're asking public health officials, instead of protecting the public health, it's like Alice in the Looking Glass. I'm not going to tell you what will protect you. Honest to God. If you live in Louisiana, if you're there, here's an action for you. If you live there, call the Louisiana Health Department and let them know that telling healthcare professionals to not mention vaccinations for flu, COVID, or monkeypox is putting public health at risk. And that's the opposite of what those doctors are trained to do. I think if you look in the newsletter, there's a link to their webpage, and that should have a phone number. Okay, that's what I've got for you today. Down below, you can like, share, subscribe, send me comments here at YouTube or at healthcareadvocacy1@gmail.com. Have a good evening and a Happy New Year.